All right, hi, and welcome to January Grand Rounds, Rehabilitation Movement Science Grand Rounds for 2023. I'm excited to welcome everybody in person, as well as everybody live online, and everybody who's watching this as a pre-recorded lecture. So a couple housekeeping things. Please make sure you scan the QR code or use the code to go onto eads.com so you can sign in. That's the way it gives you your quiz and your course evaluation, so you can get continuing medical education or continuing education for this course. If anybody has any questions about that, please feel free to contact me and I will help you out with that. Just of note, you do have only a finite amount of time. I think it's about a week to take that quiz after this live presentation. If you're watching the recorded version, that's a whole different story. You have about a week after you finish watching it. So today we have Dr. Nick DeBlasio talking to us about mentorship and how mentoring is the key to success. And I will just remind everybody, please make sure you're on mute unless you're asking a question, and we do encourage questions. But unless you're asking a question, please do put yourself on mute. Dr. DeBlasio received his Bachelor of Science and Doctor of Physical Therapy degrees both from the University of Delaware. He is board certified in orthopedic physical therapy, and he's also certified as a strength and conditioning specialist. His treatment focuses on restoring a patient's prior level of function, regardless of their age or injury, by utilizing a combination of manual therapy and exercises that are prescribed for each individual's specific needs. Dr. DeBlasio is our facility director at physical therapy at St. Luke's in Orfield. And he's also core faculty in the St. Luke's University Health Network's orthopedic physical therapy residency. Additionally, he has developed and runs the formal mentoring program for physical therapy at St. Luke's for the entire network. So, without further ado, I will turn this over to Dr. DeBlasio.
Good afternoon, everyone. Thank you for having me, Steve. I really appreciate it. Steve asked me to present on our formal mentoring program here at St. Luke's, and kind of give a little bit of background as to why I believe that this program is something that was needed within the network, and how many of us can benefit from it. So initially, the first few slides, one is the statement of need, a designation statement, disclosure statement, and then our learning objectives. Today, I hope to get out of this lecture, I hope you can appreciate and understand the benefits of what formal mentoring can bring to a company and an individual, and also describe the best practices for mentoring. A little bit of background on myself. I have been involved in the residency program since it started here at St. Luke's back, I believe, in 2013. And I have had the privilege of mentoring numerous residents in that program. And several years ago, I believe it was 3 or 4 years ago, I was asked to mentor each quarter and be involved in mentoring multiple residents within each cohort, which has been, a privilege. And I'll show you some of, as we talk today, we'll show you some of the benefits that has provided me in my practice and in my career. So what is mentoring? I believe everyone has an idea, but mentoring is defined as a developmental partnership in which a person with relevant knowledge and experience, a mentor, shares knowledge and skills in order to support other people, a mentee, in their personal and professional development. Okay. A mentor is a trusted guide and advisor who provides support and encouragement, possesses knowledge, professionalism, insight, and leadership that many others seek to emulate. Mentors are all around us, and it's whether or not we have the ability to seek one out. One is willing to work with you or work with an individual, but mentoring is all around. It comes in different forms. Reasons people choose to be a mentor or somehow become a mentor But some of the reasons: it boosts your interpersonal skills, it strengthens your knowledge, you're giving back, expands your network. It helps you to establish leadership skills, gain recognition, adds to your qualifications, can create learning opportunities for you, build your confidence. You'll gain new perspectives as you work with some younger, less experienced professionals. It can provide you with a sense of fulfillment. You feel like you're giving back, therefore you're paying it forward in a way. Self-reflection opportunities to see what you've done in the past or what you can do better. And it strengthens your network and company. So by doing the mentoring in this company already through the residency program, I've gotten to meet a lot of the young professionals. I've got to travel to different offices and re-engage with some staff I haven't seen before, work with different patient populations. And within our mentoring program within the residency, we have a strong team. I believe it's of 30 trained mentors that are willing to give their time to assist other young residents, students who are looking to, get better at their practice and build skill. So it's been great. Some of the factors that influence mentors was looked at in a study done by Yoon back in 2017. It was interesting. He was able to find that most people enjoy sharing knowledge. Most mentors enjoy sharing knowledge. They have an interest in teaching. They're motivated when the mentee is motivated. And they have a satisfaction with helping other people succeed. Some of the barriers that have come up with being able to mentor were lack of time and unwillingness and unmotivated employees or individuals that didn't want to. So what we found in trying to develop a program within St. Luke's was, what barriers were we going to would we have to actually get something to be a formal program within the network? And I'll talk about a little bit more about that later. So the question comes up: is there an actual need for formal postgraduate formal mentoring? I hope some of the things we were able to share with you today support that there actually is a need, and it's an important piece of can be an important piece of our company, an important resource for some of our younger clinicians. The APA states that mentorship has been recognized as a catalyst for career success. It's a pretty strong statement, and it seems to be one of their models. I really appreciate that I was able to find that, because I do think it is important. In a multi-purpose approach to outpatient physical therapy mentoring study I found by Bunning, he suggested that developing an outpatient mentoring program is beneficial for novice physical therapists, which is a general statement, but he was able to show evidence that supported that. So you look at what benefits does a mentee have? Well, they can improve their job performance. It can accelerate their knowledge and skill development. I'll tell you a quick little story. I had an first employee I hired as a physical therapist in my office about 6 or 7 years ago. When this individual came on and they were interviewing, I asked them a question. I said, are you interested in it taking you 5 years to gain experience, or would you like to do that in 1 to 3 years and feel comfortable and feel like you're up to speed? And she accepted the challenge, and she said, no, I would like to accelerate my learning. I really appreciate having a mentor, and I would like to have someone take me under their wings and push me to get me where I want to be. So really having a mentor can do that for a mentee. It enhances their self-confidence. It facilitates networking and communication. It definitely improves employee engagement. It helps with their personal development. And ultimately, we'd like to see improved outcomes with our patients. From a company standpoint, mentoring can offer improved employee retention, employee recruitment, improved productivity, staff development, and we can utilize this as marketing and advertising. So we can state, to younger clinicians, who are looking for their first job or looking to make a career change and move it to a different company, we can market that and advertise that. We have a program here that will facilitate your learning. And ultimately, for the company, we're going to have, we should see improved outcomes due to clinical effectiveness. Typical mentoring opportunities that exist when you're in school, undergraduate, you have clinical internships, and your CI can act as a mentor, and then that relationship sometimes will linger after graduation. We have peer mentoring. Typically see that in a clinic where you're hired and there are some more senior clinicians, facility directors that take you under their wings and kind of get you up to speed with how to do your job. But then after you kind of get your caseload, does that type of mentoring continue, or do you just get into the rut of treating? We have residency programs, for those individuals that seek them out, followed by fellowship programs. And we also have postgraduate continuing education and moving towards advanced certification in some of these programs. I do know that some certifications do have mentoring portions of their process to getting certification. And sometimes just by going to continuing education courses, you'll meet people that you can use as a reference. So you kind of get like some informal mentoring by networking and having relationships. But those are the current mentoring opportunities. I found a blog that was printed in WebPT. It was a very interesting blog. I recommend anyone read it. And then there's a bunch of links to other studies and other reports that are out there, but I'll summarize some of the key points. Ryan Gable was the therapist and author who wrote the article. And he said therapists across the board are looking for guidance and organizations that offer some form of mentorship. Those organizations that offer some form of mentorship will have a leg up on the competition. And I appreciate that comment because it says like we're separating ourselves by having a program, or potentially having a program that others are not offering. Once you are hired, we still care about you. We still want to see you succeed. We want to get you to a level that you want to be at, and here's a resource for you. He referenced the State of Rehab Therapy report from September of 2022, and they polled like over 6,000 participants in the survey. And it was interesting that 70% of those who were polled stated they were considering a career move. And one of the #1 reasons was because they had no direction or plan on how to best manage more complicated patients' plan of care, which meant that they felt they couldn't help people. That's how I interpret that. They were struggling with a large portion of their caseload, or maybe a small portion of their caseload, to get people better, and it was frustrating to them. So then they were considering their options. The WebPT co-founder, Heidi Janega, stated in this article, clinical leaders must offer career paths and growth opportunities, as well as cultivate a culture that prioritizes its staff's well-being, especially if they intend to retain their top talent. So that would minimize turnover, improve employee retention, and ultimately improve employee satisfaction. They also referenced a workplace happiness survey that was conducted by CNBC and SurveyMonkey. It happened in 2019. They do this every year, but it polled about 8,000 US workers in different fields. 91% of those individuals polled said that had a mentor were satisfied with their jobs. That's a huge number. And having a mentor proved to be one of the top factors in improving employee satisfaction. I think that's a strong statement, strong numbers that support the need for mentorship, the need for formal mentorship within the workplace. In a study by Williams in 2019, it was an evaluation of clinical effectiveness on work-based mentoring programs to develop clinical reasoning on patient outcomes. They used the patient-specific functional scale. And what they did was they compared two groups of therapists, one that was trained for 150 hours, mentored for 150 hours, and one group that had just had the base standard of training. And what they were able to conclude was that the group that got the mentoring had 80% of their patients achieve clinically significant scores versus just 63.8% that did not have the formal mentoring, which is pretty significant. In a study done by Bradley in 2023, and Kyle is one of our former residents here at St. Luke's University Hospital Network. He compared photo outcome measure scores, which is photo is the focus on therapeutic outcomes. It's a risk-adjusted patient outcome with a high degree of reliability and predictive validity. He compared residency trained versus non-residency trained board certified clinicians. And the residency trained clinicians do get 150 or more mentoring hours within their year of the residency program. And he was able to conclude that post-professional training leads to a meaningful improvement in patient care and success. He was able to show, by pulling data from the photo numbers over a year, they look at 3 domains. They look at satisfaction, utilization, and effectiveness. And the therapist the residency trained therapist with the mentoring hours had clinically significant effectiveness scores over a 12-month period versus the non-residency trained therapists. That's pretty powerful. And then closing statement in that blog was, the structured mentorship programs that seek to provide unique opportunities for clinicians will excel in creating best-in-class professionals. So we continue to strive to have our employees that we hire get better and have their needs fulfilled. How can we do that? How can we make that something that is readily available for people? And how can we ensure that we're meeting needs of our employees on an ongoing basis? So about a year, almost 2 years ago, we conducted a study at St. Luke's University Hospital Network in our outpatient therapy department. And we were able to, the survey was geared towards finding out if people were interested in having formal mentoring. And I believe we had about 182 respondents. Most of them were PTs and assistants, but we had some occupational therapists and some speech therapists who participated. And some interesting findings in that survey. 96 respondents, or 57.5%, were interested in a mentoring program, which is a great number. And 122 of the employees that responded had been practicing for over 5 years. So they, even though they were considered more senior clinicians, have basically stated that they believe having a mentoring program would be beneficial. So it leads us to, should we develop a mentoring program, and how do we go about doing it? So the first thing we have to do is we had to choose a goal. What was our goal? What was our goal by developing a formal mentoring program, and what did we need to do it? The goal we came up with was to provide a resource for clinicians who desire or need postgraduate mentoring to improve their outcomes, knowledge, skills, and patient satisfaction. And patient satisfaction is huge. You know, we all get stuck with patients who we want to do more for, and we're trying, but we may not know exactly how to address their needs. So then we had to choose a format for the program, okay? And there's different forms that we could use. So you can use a formal, which is more structured one-on-one, pairing a senior clinician with a novice clinician. You can do informal, which is kind of like just in the clinic, asking questions and getting help when needed. Or we could do more group type mentoring, where you would have people meet, we go over a topic and talk about it, and maybe bring in some guest lectures and talk about different topics. Referencing back to the study we talked about earlier, Yoon also looked at the type of mentoring that would be most beneficial. And in this study, they basically said most mentoring would last between 1 to 6 months. And most common method of interaction was one-on-one in a structured environment, 96%. Okay, so that gives you more of like a formal type of mentoring program. Usually in the study, they basically showed that most of it was weekly, in person, and structured, whereas you can have it monthly as well, and that was a strong number as well. And most mentees were just colleagues. Okay. So at St. Luke's, we decided to use a one-on-one patient consultation type of a program where we would do a case review, have discussion, literature review if needed, and then talk about the skills that we learned, some new diagnostic techniques and new treatment techniques, and make sure that the clinician was proficient at it. So this is kind of how we were going to structure it. We'd have a mentor paired with a mentee, and the one-on-one consultation would be a patient that the mentee was having trouble with. The therapist, the primary therapist, the mentor would come in and do a full evaluation consultation, and then there'd be discussion thereafter. Currently, it's up to 6 months, but I believe it can go longer depending on need. So the next step was coming up with who wants to be a mentee and what mentors we were going to have within the network, and then matching and pairing them. So from a mentee selection standpoint, self-nomination is obviously the way we want to get people interested and involved in the program. But we could also have facility directors or regional directors nominate. And now we are also looking at having program managers nominate individuals as well. Guys, if there's any questions at any point, please, raise your hand or chime in, or if Steve gets a message, I will try to answer a question. So from an application standpoint, we had to set some kind of standard to ensure that we're getting people that are interested and have an actual need. So it says 2 years of experience or completion of a residency program. So 2 years, we wanted to ensure that therapists were eligible for direct access. Okay. For the first year of employment, we were hoping that most mentoring was occurring informally within the office. And then after that, another year of experience and then getting more formal mentoring. We have more data from our outcomes with photo after 2 years, and we believe that direct access certification is really important to have. We'll be looking at photo effectiveness and satisfaction scores. The mentee would have to define their goals, specific goals as what they're struggling with, what they would like to work on with the formal mentoring program, and we would need facility director approval. From a mentor standpoint, most mentors are trained within our residency program, and what we do is we go through, a process where you are going to observe a mentoring session, and then you're going to be supervised to actually implement a mentoring session within the residency program. And you also have to go through orientation. So we pulled from a group of trained mentors within the residency program as candidates for our formal mentoring program. And we utilized, I'll go with that in a second, and then the additional training that the mentors require was an orientation to the formal mentoring program, going over procedures and how we're going to record and collect data. Mentoring selection was based on whether or not they had completed all the training and mentor evaluation scores that are completed after each mentoring cycle within the residency program, and looking at the scores. Because of our large network and multiple regions, we try to pick mentors that had good evaluation scores. And we also like to look at where they are within the region and make sure we have a diverse location of qualified mentors. And then we would pair the mentor with a mentee based on region. And lastly, how do we evaluate our program? What are we using to determine whether or not this program is beneficial for our patients and for the mentees. So the way it's structured is a mentee was paired up with a mentor. And what they're going to do is they're going to pick out a patient who they believe they're struggling with. It's a challenging patient, a challenging case. They may feel like they're struggling and not getting to where they need to be. So what we'll have is we'll have an initial evaluation and a photo score. And the photo score usually gives a predicted score, predicted number of visits, and then the duration of treatment. Once the patient is identified as someone that they want to potentially do a consultation with, we need to obtain a second photo to ensure that we can see that maybe the outcome is not going how we would plan with our initial plan of care. We obtain a global rating of change, and then you describe specifically what the concerns are and state the objectives of having a consultation. Once it's scheduled, the mentor will come in and do an evaluation. The way I've been doing it, and some of the other therapists who, other mentors within the network have been doing is kind of come in and you don't really know too much about the case. You know what the mentee's concerns are, you know what they have tried, and you're coming in and doing your own evaluation consultation where you're looking at the chart, doing a chart review, and doing your own history and own evaluation. Now, by doing it that way, the mentee gets to see your process, gets to hear the questions you're asking, gets to see your cascade of evaluation and treatment techniques, and gets to see how you did it, and they're comparing how they did it. After the consultation, you can discuss, you go through discussion talking about why you did what you did, what you found, why you treated, why you chose which treatments, and what the plan of care is. So the mentor afterwards will have to, complete a small form that gives feedback on the assessment, the findings, the plan of care recommendations, new diagnostic or evaluation techniques utilized during the consultation, and the mentee will provide self-reflection and feedback on the same form. Then within 4 weeks after the evaluation or the consultation, the mentee must obtain another photo and another global rating of change. We would like to have a patient survey completed to see what the patient's opinion of the consultation was and how it affected their plan of care, how it affected their recovery and their outcome. And we also want the mentee to be able to demonstrate competency with the new diagnostic and treatment techniques. When we look at outcomes, we're going to be comparing our photo scores. We're going to be comparing the second and third photo score. We're going to be comparing global rating of change pre-consultation and post-consultation. The number of visits that are needed to obtain those numbers. So you have an initial number of visits prior to the consultation and the post-consultation number of visits. And then we also want them to demonstrate the competency with the new techniques. So our initial data, which was taken from August through December 2021, these are 4 cases that were fully completed with patient feedback. And you can see patient number 1, the first consultation happened around visit number 23. And then by visit 27, we had a pretty significant improvement with a change in plan of care. You see that again in patient number 2 and again in patient number 4. Not so much in patient 3, it was more of a, just a gradual increase. But you see how the consultation date in all 3 out of 4 patients, there was a significant change in the photo scores thereafter. So our current program, we have 5 trained mentors within the program. We have 4 current mentees, and we have had 16 patient consultations performed thus far. Our first cohort technically started in September of 2022. So you can tell it hasn't been active too long, but we have a decent number of patient consultations so far. So, like I said, in each one of the cases, we get patient feedback. And in this patient feedback, it's hard to read, but he said basically before the consultation, the surrounding area was treated. But since the consultation and therapy, the target area was immediately identified. the primary therapist was able to adjust therapy techniques that have been extremely beneficial in my recovery. The impact was immediate. What has taken a couple of months in previous treatments for minimum recovery has seen significant turnaround in my recovery and under consultation treatment plan. Another patient feedback said he was able to teach them a new technique that was instrumental to my recovery. Once implemented, my rate of recovery sped up. And I got feedback from all the mentees who are involved in the program right now. And I'll read them out to you. I think they're great. So the mentoring program has been a great resource for me to pull from. If I've tried multiple different treatment pathways with a patient and not seeing improvement, it is beneficial to be able to provide the patient with another set of eyes and assure them that as much effort as possible is being put into their care. So they know when you bring someone else in, you're singling them out and making them special. You're having someone else come in who's taking time out of their day, time away from their office or their caseload to address your concerns or the patient's concerns. So it is a very powerful thing. Every consultation I've had so far, the patients are so happy and so excited that someone is there taking extra time to work with them. Another feedback we got was, I've really appreciated the opportunity to be paired with a senior clinician. It was such a benefit to learn from a Maitland certified clinician. Not only did he guide me through applying Maitland principles to the lumbar and cervical spine, but it kickstarted my interest in the subject outside of work. One of our facility directors and orthopedic clinic specialists is going through the program and stated, mentoring has helped broaden my clinical skills with different ways of thinking to help address patient cases that aren't improving. It has also improved my confidence with other manual techniques and dysfunctions to look for if my initial plan of care isn't helping the patient improve. It's giving therapists alternatives on how to approach a patient care. And lastly, one of our graduates of the orthopedic residency program stated, this program allows us to take a patient who has been struggling, potentially with multiple bouts of therapy, and show them that they are more than just a number in the clinic by pulling in as many resources as possible. I know this has helped in building a positive reputation for our clinic and my rapport with patients. So with that, I will open up any questions, and I thank you guys for having me here today to at least give you some insight on the program and why I believe mentoring is such a valuable resource that we have available to us in this company.
So we do actually have a couple questions. The first one is, did the 4 patients that you highlighted differ based upon based upon specialty, but like neuro, ortho, peds? Yeah, so great question. Currently, all of the patients we're pulling from are from ortho. The mentees that we are currently in the program are primarily orthopedic physical therapists. Most of those patients that we did consultations on were back patients, that I remember correctly, if I remember correctly. So, by the way, great presentation. Earlier on, you mentioned a study showing job satisfaction with mentoring. Yes. Do you happen to know what the job satisfaction was without having? That's a great question. I have to look into that. I can definitely get that and email it out to you guys, but it definitely is in that article. I just pulled out the strongest number that I felt was relevant for the. I believe it was Mackenzie. Did I say Maitland? I apologize. We have for the mentor, what amount of time is given for providing the mentoring in your job? So, meaning, if I'm understanding correctly, like how many hours a week or how many hours are allotted to the program?
Yes, that's
Okay.
the question.
So right now, we're utilizing it on an as needed. So the mentee is kind of in charge with how many hours. So the way it's structured is we're looking for once we get we pair the mentor or the mentee, it's the mentee's responsibility to seek out the mentor.
The mentor is just there to assist when needed. I believe right now we can do up to 1 to 2 hours per week maximum. And there's really not much more needed outside of that at this current time. The way that we structured it initially was that we were trying to have it over the course of 6 months, and within that 6 months, kind of keep it somewhere around, 20 to 30 hours of time during that period of time. And so far, we haven't touched that.
That one of the reasons you chose 2 years of after 2 years of experience, so that people have a better idea of knowing what they do when they need it.
Yeah, so one of the reasons I chose to push for like 2 years was primarily for the development of pattern recognition, and to be able to say, I've done this in the past with these type of patients, and I'm currently doing this with my patient now, and it has worked sometimes, but it's not working now. What can I do? I believe it's important to have a nice framework, frame of reference of patients you've worked in the past, and this one's just not working. And now you got to see another way of addressing a treatment plan that does address it, and now you can pull from that treatment plan.
Thank you. Brenda, would you be able to clarify your question a little slightly better? I just did not fully understand. You can unmute and ask. I believe she's asking, what are the qualifications to be a mentor?
Okay. Right now, the qualifications are that you are trained through the residency program, going through to be qualified as a mentor within the residency program, and then once chosen to be part of the formal mentoring program, it is about another hour to 2 hour maximum of getting trained, so you're oriented to what needs to get done within, and how we're structured, and what we need to get done in the formal mentoring program.
And just to add to that, to be, this is not, to become a mentor in the orthopedic residency program, you need to be board certified and or residency trained. You also need to go through a pretty rigorous training program to get there.
Correct.
And for this mentoring program, we're taking a select few of those mentors.
Correct. And based on scores that we are receiving through the residency program about how we did with mentoring.
Experience for residency mentoring. Years of experience isn't a qualification, it's the other things. Do you add any years of experience on as requirements, or is it based upon mentors evaluation scores?
Currently, it's based on mentor evaluation scores. Years of experience are factored in, but not an actual defining reason to be a mentor. And guys, this program is early on. We are just starting. Our first cohort technically started in September, and it is January. So we are currently, four mentees that are working with mentors, and we hope to see this expand as people see how it's valuable. That's why we did this presentation today.
Okay. So another question, how is or was the formal mentorship program being promoted to staff?
Great. So in August of last year, information was sent out to all facility directors. I believe actually all staff. It was a broadcast email indicating, that we did have this program, and that facility directors initially were to talk to their staff about whether or not they would be interested in the program. Sorry. In June, yes. So before the broadcast email came out, the facility directors were, educated in the fact that we had this program, and to start thinking about if there's anyone that might be interested in it. formally went out in August, and then we started accepting applications thereafter. We fully plan on having more broadcast emails with some more information provided to the facility directors and staff about this program. And we also now have this presentation that people can reference if they did not have the ability to, tune in today. You guys have.
All right, well, if you think of any other questions, please feel free to email Dr. DeBlasio or email me. And I really appreciate everybody's time and for being on today. Please make sure you take your quiz and your course evaluation to make sure you get CE credit for today's presentation. Thank you very much.